Hi friends, today I am going to give you a basic algorithm for an easy classification of acetabular fractures. To classify the acetabular fractures looking at the X-ray has been a daunting task for most postgraduate residents. Many times we are given only the AP X-ray, though for accurate classification on X-ray we require an obturator oblique view and the iliac oblique view in addition to the AP view. But generally, the two special views that I have mentioned, are not usually taken in a trauma setting in most of the centers for fear of further damaging the patient or due to pain that occurs for the accurate positioning of the patient. So we are given only the AP view, but it is better that we insist for or make an attempt to do the obturator oblique views and the iliac oblique views. Of course, CT scan help with the present available softwares for 3D reconstruction, helps in better understanding of the fractures. But I am here to tell you that with a basic X-ray, you can classify these acetabular fractures more or less accurately if you know certain steps. The the classical classification for the acetabular fractures is the Letourneau and Judet classification. According to the Letourneau and Judet classification, there are 10 types of acetabular fractures, of which 5 are elementary. The first 5 types are the elementary type. They are the anterior wall fracture, the anterior column fracture, the posterior wall fracture, the posterior column fracture, and the transverse fracture. And there are 5 associated types of fracture, which are the both column fracture, an anterior column with a posterior hemitransverse, T-shaped fracture, a transverse fracture with posterior wall, and a posterior column with posterior wall. The, the objective question from this aspect, from this point is, now in the elementary type, 5 types, there is only one fracture which involves both the columns. This is the transverse fracture. In the associated types, we have to understand that in the associated types, all fractures involves both the columns, excepting for the posterior column, posterior wall. So the classical both column fracture that you mentioned means an acetabular disruption or discontinuity from the sacroiliac joint. Though all the 4 types of the associated fracture, associated type of fracture, are involving the both column. So that has to be drilled into your mind. Now, there are a few questions that you have to ask when you see an X-ray of a fracture acetabulum. The first question that you have to ask is whether there is an involvement of the iliac wing. The answer yes or no. If the answer is yes, if the answer is yes, that means the iliac wing is involved. It narrows down the possibilities of the 10 fractures into 3 fractures. It can be an anterior column, isolated anterior column. It can be an anterior column with a posterior hemitransverse, or it can be a both column fracture. Now, how to distinguish this? Now, the next question, if the iliac column is involved, the iliac wing is involved, the next question is whether the posterior aspect of the ischial spine is involved, yes or no. If the answer is yes, it narrows down to 2 possibilities. It can either be an anterior column with a posterior hemitransverse, or it can be a both column fracture. Now, if there is no posterior ischial spine involvement and only the iliac wing is involved, it is an isolated anterior column fracture. So, very easy to classify the first 3 types. Now, if the ischial spine, now we have 2 fractures that are remaining. What is the anterior column, posterior hemitransverse, and the both column. So we have asked the question, iliac wing fracture, yes. Ischial spine fracture, yes. The next question is whether there is a bony fragment attaching the acetabulum to the sacroiliac joint. If the answer is yes, it has to be anterior column, posterior hemitransverse. If no, that means the acetabulum is discontinuous. there will be the spur sign that is present in obturator oblique view, and that becomes a both. That is the one that is a classical both column fracture. Okay. Now, the first question was whether the iliac wing is involved or not. Now, we discussed the three possibilities if the iliac wing is involved. Now, if the iliac wing is not involved, the answer is no. The next question again, the question is whether the ischial spine is involved or not. If the ischial spine is involved, yes, there are five possibilities now. It can be a posterior column fracture. It can be a posterior column with a posterior wall fracture. It can be a transverse fracture. It can be a T-type fracture. It can be a transverse with posterior wall. Let us see how to distinguish them by further questioning. So we have asked two questions now, whether the iliac wing is involved, whether ischial spine is involved. Now, if the ischial spine is involved, is there a break in the inferior part of the obturator foramen? That is the next question. Yes or no? If it is yes, there are three possibilities. It can be a T fracture, it can be a posterior column fracture, or the third one is a posterior column with a posterior wall. Now, if there is no break in the obturator foramen, at the same time, there is a fracture of the ischial spine, and if there is a fracture of the ischial spine, there can be two possibilities now. One is a transverse fracture or a transverse fracture of the posterior wall. Now, how to distinguish these three possibilities? If yes, the three possibilities. Now, the question now is whether the pelvic inlet is involved. Pelvic inlet or the floor of the acetabulum is involved. Now, if the pelvic inlet is involved, it has to be a T-type fracture. So, the ischial spine is involved, the iliac wing is not involved, the obturator foramen, the inferior part of the obturator foramen involved, there's a fracture of the floor of the acetabulum, it has to be a T-type. If it is not there, if no, if the ischial tuberosity or the obturator foramen is not involved in the fracture, it has to be a posterior column fracture or a posterior column with a posterior wall, if there's a posterior wall element. So, the linear arcuate, you have to understand that it is the inlet of the pelvis. It is seen in the X-ray as a fracture in the floor of the acetabulum. Now, the difference between a transverse T-type or the posterior column fracture, the fracture line is more towards the greater sciatic nerve. It does not involve the floor of the acetabulum. Now, if there is no iliac wing involvement, no ischial spine involvement, the remaining two items are the anterior wall and the posterior wall, depending upon where the fracture is. So, by asking these five questions, we can make a classification and a more or less accurate classification of the fracture by looking at the X-ray now. I am going to give you the chart of the algorithm. Let us just rush through this. The first question, whether it's a fracture of iliac wing. If there is a fracture of iliac wing, it narrows down to three possibilities: anterior column, both column, anterior column hemitransverse, posterior hemitransverse. The next question, whether ischial spine is involved or not. If there is ischial spine is involved, two possibilities: both column fracture, anterior column with posterior hemitransverse. In that case, if there is an articular fragment which is attached to the sacroiliac joint, it becomes an anterior column, posterior hemitransverse. If the acetabulum is free, it becomes a both column fracture. If there is no ischial spine involvement and there is only anterior column involvement, it becomes an anterior column isolated fracture. Now, if there is no iliac wing involvement and there is an ischial spine involvement, there are five possibilities. These can be distinguished by further questions: whether there is involvement of the inferior part of the obturator ring. If it is yes, two more questions we have to ask: whether there is involvement of the inlet of the pelvis, which means that is a T fracture. If there is no involvement of the if there is no independent, if there is no involvement of the linea arcuata, it can be a posterior wall or a posterior wall with a posterior column, depending upon the presence of the posterior wall fracture. Now, if there is no fracture of the obturator ring and no fracture of the obturator ring, if the linea arcuate is not involved, it becomes if there is no fracture of the obturator ring, that means there is going to be a transverse fracture. If there is a posterior wall along with that, it can be a posterior wall. Now, if no iliac involvement, no ischial spine involvement, then you have two possibilities: anterior wall, this elementary type, anterior wall, posterior wall, depending upon the what is the which part of the acetabulum is involved. Now let us go through some of the exercises here. Now, for just to understand the we do a few exercises for off the bullet site. Let us see one X-ray. Whether let us see whether we are able to classify this fracture. You can see there is a fracture of the acetabulum. The first question is iliac wing involved. Can't find any iliac wing involvement. So the first three possibilities are out. Now there is an ischial spine involvement is there, and we look at the ischial spine involvement is there.